go out into the woods, you know, we're chopping wood, we're being quite adventurous. Some people are taking knives and axes, other people might even take live firearms. So having an extensive first aid kit, I think, is pretty paramount, really. But more important than what you've got, of course, is how to use it. You know, it's training, it's access to training, and then it's a kind of remind and revise. You can be the greatest kind of paramedic in the world, but if you haven't had any kind of remedial training, hands-on, remind and revise for a long time, obviously you're not as sharp as perhaps you should be. So that's something to bear in mind. We're talking about kit and equipment, but actually the fundamental, the most important thing is kind of access to training. So if you've got your first aid at work, if you've got your FPOS, if you've got your hostile environment, if you're an ambulance technician, ambulance paramedic, you know, nurse, doctor, people in the medical profession can end up in all sorts of weird and wonderful specialities, and they forget where they came from. You know, I've worked with consultants and neurosurgeons that have been working at that kind of top end level so long, you know, to come across a basic life support, you know, CPR type emergency, they are unfamiliar with, although they, of course, they are at the top of their profession in, you know, in psychiatry, in neurosurgery, in the radiographers, the possibles are almost endless. But basic life support is kind of where we all start. This is quite an extensive bag. What I will say is, before you even open your bag and you're kind of walking up to the patient, you are soaking up the environment, you know. So a very basic fallback is kind of airway, breathing, circulation, arrest major hemorrhage. But before that, it's Dr. ABC, it's danger, it's safety first. Is this a safe environment for me to go into? You know, I remember going to road traffic accidents, you know, that happened on the blind bend in the middle of the night. And of course, if we'd have just rocked up and I'd have dived into that wreck, it's highly likely another car travelling pretty fast is going to come around that corner and smash straight into us, and then you're just another casualty. So sometimes, you know, scene safety is a skill within itself, and it's the same with any kind of scene that you will walk into. Sometimes there'll be drink and drugs, sometimes there'll be altercation or a fight in progress, and all that stuff has a danger to you as you walk up to the scene. So safety first, and obvious dangers, you know. Very, very easy to just become another casualty with the best intentions in the world. So that's the sort of stuff that's going on before we even commit to scene. I'm going to bring in a bit closer. I'm just going to elaborate on this a little bit more. So before we even kind of open our bag, we're walking up to scene, and we're after some indication as to how this person has sustained their injuries. You know, so was there a fight in progress? Is there an altercation? Was it a road traffic accident? And as we get closer and closer and closer, we are trying to assess the patient, and we haven't even put a hand on them yet. So is there a big bullseye on the windscreen of a car that indicates that that person has been hit by a car and maybe gone over the top of it, and we find them laying in the road? So the mechanism of injury we're getting before we even get to the patient. Once we kind of arrive at the patient, you know, alert, verbal, painful and unresponsive. So how is the patient? You know, are they sitting there talking to someone else? Have they got a patent airway? Are they screaming? Are they bleeding profusely? Are they deeply unconscious? We're getting all this information before we've even touched a patient. But immediate action drills and first aid is how we save people. Sometimes you can arrive on scene and be absolutely overwhelmed by what you see in front of you. And having a pre-rehearsed, muscle memoried immediate action drill that you are going to commit to is the way to overcome that freeze phase, you know. So some people keeping it very, very basic and very, very simple. you know, Dr. ABC, so the initial danger of the scene, and then we go on to, is the patient responsive? Airway, breathing, circulation, arrest major hemorrhage. That's what we're going to do. You know, that's our immediate action drill. You know, there are varying types of immediate action drill. So I've given you Dr. ABC, but from a military point of view, there was always, you know, all-round defence, centralised casualties. Then we get on to taking sensitive equipment off of the casualty, just in case they kind of die or fall into enemy hands. Then we're talking about administering morphine, so pain relief. So if we're going to do that, then we need to remove ammunition and grenades, all that sort of stuff, because the last thing you want is someone out of their tree on morphine with a loaded firearm or access to explosives. So we're going to kind of do all that, and then we're into a military system called March, and March is massive blood loss, it's airway, it's respiration, it's circulation, so we're back, arrest major hemorrhage. Then we have 3 H's, and the H's are always hypovolemia, again massive bleeding, head injury and hypothermia. So on a military setting, that's the sort of considerations that are going on. In a civil setting, we're into kind of scene safety, we're into scene management. Until you manage the scene, until you create an environment, you have to create an environment that you can succeed in. So if there's a fight in progress, we need the police. If there's whatever complication it is, we need to overcome that first before we can start to treat and save people. Otherwise we just become another casualty. So we've got all that going on. Now we're actually kind of walked up to the casualty, and again we haven't even opened the bag yet, but we're looking at whether they are, what their level of consciousness is, if they're talking, if they have a patent airway, if they're screaming, blah 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 blah. I remember going to a bank robbery in a place called Randburg in South Africa. 2 guys walked in the bank and shot everybody, and there was no one to get them the money. But my point is that I turned up, 1 or 2 paramedics, and we had 18 people with gunshot wounds. So we had to put people to work helping each other. Out of the chaos of that environment when we arrived, you have to prioritise, you have to triage. So we had 5 people screaming their heads off, so they all had patent airways. We had another 5 or 6 people that were running around bleeding, you know, so suddenly they weren't the priority, and that was 11 people down straight away. We had 4 people that were quiet, that took us up to 15, and there were 3 people being assisted or helped by bystanders. So the people that we checked first were the quiet people. 1 of the quiet people was dead. The other 3 quiet people were our priority, and they had varying injuries. But out of that 18 people, only 1 person died. And the way I triage that is everybody that can move, stand over there. And what happened was we had 10 or 11 people that got up and moved. So we had 7 people, and like I say, 4 of those were quiet, 3 of those were screaming their heads off. We checked the quiet people first, then we move on. There was a guy who got shot through the hand, and he had a severed brachial artery. So what we did with that bleed was a couple of big ambulance dressings. So big ambulance dressing, direct pressure. Then I put a BP cuff on. I inflated the cuff till the distal pulse disappeared. So now I've got a tourniquet. Let the cuff down until the distal pulse just comes back. Elevate the wound. Yeah, got a bystander. Hold this guy's arm up in the air. If he goes quiet, come and get me. Move on to the next patient. So an awful lot of patient assessment is done before you even open a bag, even get out a bit of kit. You know, we're looking at, are they pale? Are they sweaty? Are their eyes open? Do they respond to voice? All these things we're getting before we've even touched the patient. So this is my final bit of kind of medical kit. It's in a red bag, so Try and keep it in an obvious place, so that just means that I can turn around to a bystander or anyone on scene and say, go to the truck and bring me the red bag. It's not something that I'm going to sort of every time take to a casualty or somebody that's hurt or injured. Most of the time I'm going to leave it in the truck. But like I say, nice big obvious red bag. You can turn around to a bystander and say, go to the vehicle, open the back door, bring me that red bag. Yeah, so that's what we're up against. So it's a dry bag, and this is kind of tips, this is bits and pieces that I'm going to use to help me move a patient. So because it's a dry bag, what we can do is we can fill it up with air. And straight away we can use it as a pillow for a patient. I've got an red ambulance blanket here. It's got a couple of elastic bands around it. It's literally a bed roll. Just going to roll it out. Got a couple of things. Got a high-vis orange emergency blanket, and bright orange because maybe I'll put it out as a air marker panel just to show people where I am. It's waterproof, so what I can do is kind of cover the patient up and keep them warm with it. This is a thing called a carry sheet. So going back quite a long time, ambulances used to put a carry sheet on top of the trolley bed in the back of the ambulance, so that when we moved the patient into hospital, we could put the trolley bed by the side of a hospital bed. They were already on this canvas sheet. We could use the canvas sheet to just slide people across. It's got carry handles on it. It's good for 250 kilos, something like that. You could lift a very substantial patient. If you could put that on the bottom, that would be great. The thing I kind of put on top of that is normally this makeshift sort of space blanket. I like this particular blanket because it has a kind of paper lining. This paper will absorb body fluids, so if people are incontinent of urine or they're bleeding, anything like that, you will see it at a glance. So I kind of put that on top of the carry sheet. Now I'd put my patient, and I can just fold that over the top, just to attempt to keep them that little bit warmer. Over the top of that goes, this is an old ambulance blanket. I've had it years and years and years. It's about sort of 8 foot by 4 foot. Use it however you think appropriate, but very simply, I would use this blanket this way. So as the patient kind of laid on the sheet, what I'd do is I'd lay the patient on the carry sheet, and then I'd just fold in the corners, and I'd fold both sides over. So head sticking out there, patient's got a pillow, and as I've said before, it's always going to be pouring with rain. So I've got a waterproof cover just to go over the top. So this is how I sit waiting for the emergency services to arrive with my patient. Hopefully, you know, we're keeping them warm, so we're reducing the level of shock. It's patient made comfortable, loads of tender loving care, and you know, this sort of treatment, very simply, I think is the alternative to death. You know, an awful lot of people you know, lay on the ground. They can have some sort of initial medical first aid treatment, but then they go into shock, they become hypovolemic, and the next thing they're going down and down and down and down and down. Making a patient comfortable, keeping them warm, keeping them reassured is, you know, the cavalry are coming, we phone emergency services, they're on their way, they won't be long, da 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 da. All of that is a massive part of your job as a kind of first aider and an initial medical response. You know, if the weather's bad, you can put a couple of tent pegs in the bottom, drag it up, and you can peg it to the ground at the top, you know, over the patient, you know, so it's not blowing away, you're not chasing it all the time. So that's how I intend to, if necessary and appropriate, to transport a patient. I'd get 2 or 3 guys, we'd all get round it with the carry handles, we'd pick the patient up and we'd move them to a metal road. This is the equipment that I would use to do that. It's in a bright red bag, so I can turn around to someone and say, go to the truck, bring me the big red bag. It complements my medical bag that I've already kind of shown you. I think it's probably a good time to just show you one more thing before I conclude this little kind of basic first aid, first response type medical equipment. Just like to put something on the table for you. Splinting. You'll find that not a lot of people would carry splinting equipment in a bag like this, but there are Loxley splints, there are inflatable splints, there are vacuum splints. A set of splints will probably take up the same sort of size pack as this, and it'll cost you, you know, £200, something like that. So people tend not to have them in a first responder bag. I've got some SAM splints in this bag, but they will not give you extensive splinting. You know, they're a very useful item, of course, don't want to knock it, but they're not exactly the most robust, capable item. So what I tend to use is disposable cardboard splints, and I carry a set that I've just slipped into the back of the bag. These are, I think, brilliant because they, as you can see, take up very little room. They are disposable, they're cheap to buy, and you can even make them for next to nothing. So it's just cardboard with a piece of sponge stuck to it with holes cut in it, and what you do is you shape this to the shape of the limb and then tape it in place. You can either tape it in place with medical tape, or I made one for my daughter recently, and this one is exactly the same, homemade, laminated cardboard. I use bubble wrap instead of foam, and I use black tape. So you could definitely make something like this in the field if you have the basic ingredients. So these come in 3 sizes. That's 18 inches, there's a 24 inch, and this is a 34 inch. So for example, if you had an adult male who had an extensive, you know, fractured ankle, lower leg, knee, even a femur, you know, you could use something like this to shape, tape in place. If you need to shape it, you just get your trauma shears out, you cut the cardboard, and you can make a foot very simply with it. The greatest advantage of these is that they're disposable, there's no risk of cross-infection, they're x-ray friendly, they're light to carry, and what I've done in the past, when I worked in the townships in Africa, there was no budget for medical supplies, so we used to make our own during our downtime, and these are exactly the same. So I've just used these as a template. I've got a couple of bits of cardboard. The flumes in this cardboard go this way, the flumes in the top piece go this way, so they're laminated, and then I've just stuck a layer, 2 layers of bubble wrap onto the cardboard. So I've made these out of old cardboard, old bubble wrap, and a tin of adhesive glue. Yeah, and I've literally just laminated them up, but this is exactly the same product. So a set of these where you have an 18 inch, a 24 inch and a 34 inch set of splints. You could splint almost anything in the field. You make these for next to nothing, and suddenly you have taken your first aid trauma medical kit to a completely different level. You know, so disposable splints, make yourself a set for next to nothing, They will complement your medical kit, and they're really light. Like I say, these ones fit into the back of my medical bag. And suddenly we're ready to rock and roll. I think this is where I say please thumbs up, share, like, subscribe, and if you're watching on Facebook, please follow. As always, any comments, love to hear them. Back soon.